Okay na. Pero kakaunti pa lang din 'to. 11 pa lang yung nasa silid. Okay, so yung mga hindi pa nag-join sa silid, so paki-join na lang din. Okay? Okay, so for our next lesson, we'll have lesson 2, the healthcare system. So for the intended learning outcomes, we have described the healthcare system from international, national, and local perspectives, identify the goals and functions of a health system, establish the relationship between the system building blocks and health outcomes, and describe the structure of the Philippine healthcare system. Okay, so for healthcare system, so in 1968, according to Bertalanffy, it is an arrangement of parts and their interconnections coming together for a purpose. So the health system is composed of many parts, such as the community, the Department of Health, healthcare providers, health service organizations, pharmaceuticals, health financing bodies, and other organizations related to health. So the functions interconnected to one another are policymaking, regulation, healthcare service provision, financing, and managing sources. So in 1991, Romer defined health systems as the combination of resources, organization, financing, and management that culminate in the delivery of health services to the population. And in the World Health Organization report in 2000, health system was defined as all the organizations, institutions, and resources that are devoted to producing health actions. So in short, healthcare system or the health system is everything that takes part or participate in the healthcare delivery service. Okay, so for the betterment of the health status of the population. Next, we have the goals and functions of a health system. So first, we have improving the health of the population. So of course, the purpose of the healthcare delivery system is to promote health, okay? So it is the overachieving or overarching goal. So it is the ultimate goal of the health system. So the health status can be measured over the entire population and of course among different socioeconomic groups. So the safety of populations must be protected from existing and emerging health risks. So infections, okay, so should be controlled and there should be preparations for the future for the unknown health risks. So yun ay ginagawa by informing the public regarding ways on how to prevent the transmission of infections. So health systems should also strive for equity and health. So it doesn't matter kung saang strata ka kasama, so it is the goal of the universal healthcare law that everyone should receive the primary healthcare, kahit taga saan ka man, kahit nasa far-flung areas ka man. Okay? So the inequitable disparities in health should be minimized. So ano ba yung inequitable disparities in health? So first is of course income, okay? So those that are poor may have some difficulties in purchasing, okay, in purchasing the healthcare delivery, okay? Another is ethnicity, okay? So sometimes culture may affect the delivery of the health system. Next, occupation, gender, geographic location, of course, lalo na yung mga nasa isolated areas. So, medyo mahirap to deliver the primary healthcare. Next, sexual orientation. So these are the variations in health delivery. So the way the healthcare systems are organized would be the solution for these disparities, to minimize these disparities. Next is improving the responsiveness of the health system to the population it serves. So what is responsiveness? It means the provision of services to the population. Okay? So the population should actively engage in healthcare promotion. So hindi lang yung healthcare providers are the ones responsible for the responsiveness of the health system, but the patients as well. Okay, so they should participate. So it embodies values of respectfulness, non-discrimination, humaneness, and of course, confidentiality. It is very important that you treat patients with respect and of course, um, maintain confidentiality. So whatever, kung ano man yung case ni patient, hindi dapat lalabas sa iba. Okay? So it is only between the patient and the healthcare provider in charge of the patient. So health systems have the obligation to respond to legitimate non-health desires and expectations of the population. Responsive health systems maximize the people's autonomy and control. So when it comes to decision making for the health management of a patient, so the patient should be the one to decide to choose kung alin yung iti-take niyang management program. Okay? So the responsibility of the healthcare provider is to explain all the possible options that would be applicable to the patient. Pero yung decision, kung ano man yung gagawin na treatment, still lies on the patient. So that is autonomy and control. Next, so that is what we call patient-centered management. Next, fairness in financial contribution. So an ideal health system will provide social and financial risk protection in health and be fairly financed. So paying for healthcare should not impoverish individuals or families. So there should be adequate funding in the system to provide essential services. So according to World Health Organization, a fairly financed health system is one that does not deter individuals from receiving needed care due to payments required at the time of service, and one in which each individual pays approximately the same percentage of their income for the needed services. Okay, so this is all about financial equity. So lahat should be able to um to receive care. Okay, so dapat yung payments kayang bayaran ng lahat. Okay, so affordable. Okay. So a health financing system that deters people from seeking needed services or impoverishes individuals and families would worsen health outcomes. So that is the main problem sa healthcare delivery system, usually the price. So the population, they refrain from consultations, okay? So hindi sila nagpapakonsult sa doktor kahit may nararamdaman. So in the end, nagwo-worsen yung condition. So bakit kasi hindi agad na naaagapan? Because they don't have the capacity to pay for the consultations and even the medications. So kaya nagwo-worsen ang health status ng mga individuals, especially here in our country. So, we have naman PhilHealth. Okay, so PhilHealth would give some aid. So, it is an example of health financing. So, aid sa mga tao. Okay. So, for example, yung mga senior citizens. So, yung senior citizens, automatically, they would have the PhilHealth. Okay, so, once na maka 60 years old, kahit wala kang contribution sa PhilHealth. Okay? So, since ang seniors naman ay wala nang source of income. So, yun yung ginawang financial aid for senior citizens. Okay? Then, for PhilHealth, so, yung payment doon is depending on your income. So, the more jobs you have, mas malaki ang naiibayad mo sa PhilHealth. Pero yung coverage nun, hindi siya nakadepende on magkano yung nai-contribute mo sa PhilHealth. It depends on the condition. Kapag medyo mura lang naman yung medications and consultations and tests for a certain condition, so medyo maliit lang din. Okay? Um, so they think yun yung makakasolve sa equity. Okay? Para magkaroon ng financial equity. So, magkakaiba ng contribution pero same lang ng service na makukuha. So, it depends on your financial capacity. Next, we have the functions of the health system. First, of course, is the provision of health service. Next is the health service inputs, then stewardship and health financing. So, what is the provision of health service? So, ito yung ginagawa natin. So, yung gagawin nyo in the future, you provide healthcare service by providing diagnostic test results. So, the public and private health service provision is the most visible product of the healthcare system. So, this is about yung mga diagnostic tests, yung diagnosis ng physician, and of course, the patient management and treatment. So, the best health systems promote health and try to avert illness through education and preventive measures. So, aside from diagnosis and management of diseases, involved dito yung infection control o kaya control of other non-infectious diseases. So this happens by promoting hand washing, personal protective equipment, and good lifestyle. Okay? So to avoid yung mga diabetes, yung mga sedentary lifestyle diseases. Okay? So these roles and activities means that the system has to perform a wide range of activities. So delivering health service is the essential part of what the system does, but hindi lang yun yung ginagawa ng health system. Next is health service inputs. So this is inputs, so lahat ng resources. Okay? So it is assembly of essential resources for delivering health services. So ano ba yung resources that can be found in the health system? So first, of course, is the human resources. So yung mga healthcare providers. Then, medications and the medical equipment. So this function is generally outside the immediate control of the health system policymakers who have to respond to short-term population needs with whatever available resources. So for as of now, we still face insufficient health service inputs, lalo na sa human resources. Of course, masyadong ang ratio between nurses and patients, medyo marami ang nahahandle ng isang nurse. Okay? So, hindi siya yung nasa standard. Okay? So, kaya minsan, nagkakaroon ng faults in health service provision dahil masyadong maraming patient ang hinahandle. Okay? So, ito dapat yung bigyan ng solusyon, okay, of the government, ng mga policy makers to improve, okay, the ratio between the healthcare providers and the Filipino population. Next is, of course, medications and medical equipment. So, of course, we need a lot of funds for that. Okay? Next is stewardship. So stewardship is the overall system oversight. So this is the policy framework. So usually stewardship is a governmental responsibility. So more on the policymakers. So they identify the health priorities to which public resources should be targeted. Since we have limited resources, kailangan i-allocate kung saan ba yung pinaka priority as of the moment. Right? So this should be coordinated with other systems external to healthcare, and trends in health priorities and resource generation and their implications are the core of the stewardship function. So this is all on policy making and public health surveillance. Okay, so you more on paperwork stewardship. So you assess the health status, then you figure out the problem, okay? Then you make a solution for it. Next is health financing. So health financing includes collecting revenues, pooling financial risk, and allocating revenue. So health financing is a core function of the health systems that can enable progress towards universal health coverage by improving effective service coverage and financial protection. So again, nowadays, millions of people do not access the services because of cost. Excuse. Excuse, sorry. Okay, so many others receive poor quality of services even when they pay out of the pocket. So what is the solution? So of course, carefully designed and implemented health financing policies. So for example, is contracting and payment arrangements can incentivize care coordination and improve quality of care. So there should be sufficient and timely disbursement of funds to providers to help ensure adequate staffing and medicines to treat patients. So revenue collection. So revenue collection is the collection of revenue. So the collection of money to pay for healthcare services. So ito yung kina-collect natin from the patients. So the mechanisms are general taxation, donor financing, mandatory payroll contributions. So yun yung, for example, PhilHealth. Okay? Mandatory kasi yun as long as nagtatrabaho ka. Mandatory or voluntary risk-rated contributions. So mga insurance. Direct household out-of-pocket expenditures. So yung galing talaga sa bulsa natin. Then other forms of personal savings. So each method of revenue collection is associated with a specific way of organizing and pooling funds and buying services. So, for example, public health systems are financially financed, okay, typically financed through general taxation. So, yung ibang mga buwis natin serves as funds, okay, for the healthcare system. So, hopefully. Next, social security organizations like GSIS, SSS, and PhilHealth. So, mandatory contribution from workers and employers. So, sa ganun kasi, hati yung employee at employers sa contribution. Next, we have risk pooling. So what is risk pooling? It is the collection and management of financial resources in a way that spreads financial risks from an individual to all pool members. So it is the function of health insurance mechanisms. So this would help you to protect your financial resources when it comes to healthcare. So it is also essential to avoid payment at the moment of utilizing the services, which can deter people, especially the poor, from seeking healthcare when sick or injured. Each society chooses a different way of pooling its people financial risk to finance its healthcare system. So we have two types of risk pooling, the Bismarck model and the Beveridge model. So yung Bismarck model, it uses an insurance system. So the insurers are called sickness fund and usually financed jointly by employers and employees through payroll reduction. Then the beverage model naman is through tax payments. So yun, ang difference between Bismarck and Beveridge, yung Bismarck model is on employee and employer contribution, then Beveridge model is more of public health of taxing. Okay. Next is strategic purchasing. So this is the way most risk pooling organizations or purchasers use collected and pooled financial resources to finance or buy healthcare services for their members. So in the practical day-to-day interaction between purchasers and providers, the purchaser plays a key role in defining a substantial part of the external incentives for providers to develop appropriate provider-user interaction and health service delivery models. So in short, the World Health Organization's approach on health financing focuses on the core functions of revenue collection or revenue raising. So this is all about sources of funds, the government budgets, the taxes, compulsory or voluntary prepaid insurance schemes, and direct out-of-pocket payments, and external aid. Okay? So yung mga social service aid. Like, ano ba example? Mga PCSO. Next is risk pooling or pooling of funds. So the accumulation of prepaid funds on behalf or of some or all of the population. So sa risk pooling, lahat ng funds pinagsasama-sama and the allocation would be dependent on the diagnosis of the patient. Para lahat ma-accommodate, lahat magkaroon ng access sa healthcare, primary healthcare. Next is purchasing of services or strategic purchasing is the payment or allocation of resources to the health service providers. So ito yung payment, okay? Yung payroll ng mga healthcare providers. Okay? And also the strategic purchasing would enhance, okay? Would enhance yung disparity ng ratio between healthcare providers tsaka ng population. Kasi if well compensated, of course, mas marami ang mag-choose ng healthcare professions. And yung mga healthcare professionals natin would not need to go abroad to work there. Okay? So all countries have policies on which services the population is entitled to. So if ever those services are not covered, okay, so these are usually paid by the patients. So the social health insurance, community insurance, and tax-funded systems are able to help the countries as they raise, pool, and use funds to ensure the availability and use of quality services. So health system financing is a component of the universal health care, okay, and requires coordinated actions from the different financing organization and the government to strengthen human resources for health. Next, we have health system governance. So before we proceed sa framework, discuss muna natin yung health system governance. So health system governance refers to all processes and structures and institutions that are in place to oversee and manage the country's healthcare system. So this is the stewardship function of the health system. So it manages the relationship between actors and stakeholders involved in healthcare. So these people are the healthcare providers, the patients, the relatives of patients, communities, civil service organization, private sector, and of course, government agencies. So the health system governance means ensuring strategic policy frameworks exist and are combined with effective oversight, coalition building, and provision of appropriate regulations and incentives, attention time and accountability. So the purpose of the health system governance is to ensure that healthcare services are accessible, equitable, okay? So hindi equality yung ginagamit na term. So pag equality, equal lahat. So equitable, it depends on the case of the patient. Okay? And the capacity of the patient as well. Kaya equity ang pinopromote. Next, efficient, affordable yet hindi nako-compromise yung quality. So this requires efficient and equitable allocation of resources, the presence of policies and regulation guiding the healthcare delivery, and mechanisms for monitoring, evaluating, and reviewing the health system performance. So the health system governance plays a crucial role in promoting equity and social justice in healthcare. So it strives to ensure that the healthcare system is responsive. Okay, so yun yung responsiveness to the needs of all members of society, regardless of their socioeconomic status, ethnicity, culture, gender, and other factors. So yun lang, health system governance is just overlooking the processes taking place sa health system. And dapat lahat makaka-receive ng primary health care. Next, so we have the World Health Organization's health system framework. So in 2000, the functions are identified and broken down into 6 essential groups to improve targeted health outcomes or overall goals. So this is the World Health Organization Health System Framework in 2007. So it is divided into 6. We have service delivery, health workforce, information, medical products, vaccines and technologies, service delivery. Dalawa yung service delivery. Okay. And leadership and governance. So service delivery, those which deliver effective, safe, quality, personal and non-personal health interventions to those who need them, when and where needed, with minimum waste of resources. So service delivery is the provision of the healthcare service. Then health workforce, so these are the people responsible to achieve the best health outcomes possible. So this includes the number of staff. Okay, so the staff should be fairly distributed in different areas of the country. Okay, so hindi lang nasa isang lugar. So kailangan yung mga GIDAs, yung geographically isolated areas, so dapat meron din silang health workforce. And of course, the healthcare staff should be competent, responsive, and productive. Next is information. So information ensures that the production, analysis, dissemination, and use of reliable and timely information on health determinants, health system performance, and health status. So the public should be informed regarding the health status of the country. So if, halimbawa, may mataas na cases na itong sakit, so kailangan informed, okay, in any form of news. Okay, so kailangan ma-inform sila. And of course, those data should be reliable. Okay, so dapat lahat yun ay evidence-based. Next is medical products, vaccines, and technologies. So this ensures equitable access to essential medical products, vaccines, and technologies of assured quality. So these products should be of good quality, safe to use, effective, and cost-effective. May efficacy and cost-effective din siya. And they should be scientifically tested. Okay. Next is financing. So financing raise adequate funds for health. So all the people can use services when needed and they are protected from impoverishment. So hindi sila maghihirap. Okay? So kaya nilang i-afford yung medical service. Next is leadership and governance. So this is about the health system governance who monitors the health system, the health status, okay, and solves problems determined from the surveillance of health system. So these groups, okay, this essential group would lead to the improved health, okay, responsiveness of the healthcare delivery system, social and financial risk protection, and improve efficiency of the healthcare delivery. Next, so this is the historical background for the Philippine health system. So in 1970, we have the primary health care for all. So this is centralized, okay? So the healthcare system is government funded. Then in 1979, adoption of the primary healthcare. So, kayo na pa natin nababanggit yung primary healthcare. So, ano ba yun? So, this is the healthcare service that you receive. Okay? Yung una mong ma-receive na healthcare service. Okay? To solve kung ano man yung complaints ng pasyente. Next is reorganization of DOH. So, this integrated public health and hospital services. Next, we have the Milk Code 1986, so breastfeeding promotion. Next, the Generics Act. So the prescriptions are written using the generic name of the drug to lower the expenditure on drugs by promoting and purchasing non-branded medicines. So yung non-branded medicines naman, they have the same efficacy naman with the branded ones. So with this Generics Act, na-promote naman yung generic drugs. Okay? Saka para at least yung prescription, kasi syempre, the tendency of the patient, pag nakita niya sa prescription, may brand, yun yung bibilhin niya. Kasi akala ng patient, yun dapat, yun lang yung gamot na available. Okay? So, to avoid those confusions, the Generics Act was enforced. Next is the RA 7160, the Local Government Code. So the responsibility of the health service provision is transferred to the local government units. So, diba, in 1970, centralized, okay? Usually sa national government. Then, in the RA 7160, nagkaroon na rin ng responsibilities yung mga LGUs in their local government units to monitor and resolve yung kanilang health service delivery. Next is the National Health Insurance Act. So it aims to provide all citizens a mechanism for financial protection with priority given to the poor to promote health equity. Next is the Health Sector Reform Agenda, a major organizational restructuring of the DOH to improve the way healthcare is delivered, regulated, and financed. So the DOH was restructured. Next is Formula 1 for health. So this is the adoption of operational framework to undertake reforms with speed, precision, and effective coordination. Next is RA 9502, the Access to Cheaper and Quality Medicines Act. Promotes and ensures access to affordable quality drugs and medicines for all. And also, meron na rin ngayon bago na yung mga drugs na usually binibili ng mga Filipinos as maintenance medications, they are already free from tax. Like yung mga hypertensive medications, diabetes medications. So, tax exempted na sila para mas magmura pa yung medications. Next, we have the Administrative Order 2010-0036 or kalusugang pangkalahatan. So this is the UHC, Universal Health Coverage and Access to Quality Healthcare for All Filipinos. Next is sin taxes for health. So, yung mga harmful alcohol and tobacco. So, yung sigarilyo, nilagyan ng sin tax, saka yung alcohol. And that tax is supposedly a source of extra funds for the DOH. Next is the Universal Healthcare Law. So all Filipino citizens automatically are enrolled in the National Health Insurance Program administered by the PhilHealth. So all Filipinos are guaranteed equitable access to quality and affordable healthcare services. So that is the goal of the Universal Healthcare Law. Next, leadership and governance. So the DOH is the kumbaga head, okay, of all health-related concerns. So they are the ones that provide national policy, national plans, technical standards, guidelines of health. They develop technical assistance, capacity building, and advisory services for disease prevention and control, as well as supplies, medicines, and vaccines. So the LGUs were granted autonomy and responsibility for their own health services under the Local Government Code of 1991. Okay. So this is the Philippine health system. So we have the DOH regional office. Okay, so nandyan din yung national, I said, sa taas. Then we have the city health office. So for cities, usually sa NCR. Okay. So we have city hospitals, then health centers, and the primary healthcare talaga provider is the barangay health centers. Next, we have the provincial health office, then the provincial hospitals, district hospitals. Then we have the city health